Hi, my name is Pranav, and I'm a first-year ISM student here at Frisco High School. A little bit about me is I'm a senior here at Frisco. I've gone here 3 years, early graduating, so I started here as a freshman in 2012. I'm 15 years old, and I want to study spine surgery. I'm part of the Frisco High School Blue Crew, which is like, I guess, the male cheerleaders. We run around with flags and try to get people pepped up. Lots of fun. How I got involved in ISM is my friend Sophia Ortiz, who happens to be sitting here, was talking about it at lunch, and she was talking about what a wonderful teacher Coach Goff is and how she was really happy to be involved in this class. And I was really curious, so I started asking some questions about it. And this class really appealed to me because I already knew what I wanted to do, and this class gave me an opportunity to go pursue the field that I want to be in. My topic of study this year is orthopedic surgery, narrowed down to spinal surgery. So I've had 5 interviews so far in ISM. My first one was with Dr. Parikh, who works not too far from here, actually off of Parkwood and Warren. He was a family friend, so it was really easy for me to interview him. He was really easy on answering my questions and giving me direct responses, helping me ease my way into the world of interviews and the professionalism. He was actually a really laid-back doctor, more than I've ever seen. He worked in cowboy boots, jeans, and like, I guess a cowboy t-shirt kind of thing, like one of those big cowboy jackets and a cowboy hat. Only time he ever changes into scrubs is going into surgery, which I found really interesting. So his office is a private office and really laid back. So one of the 2 things about the medical field that I was really interested in is whether or not to work in a hospital or whether or not to work in your own private clinic. So his my experience with him in the interview really opened me up to showing me what it's like in a private clinic. My second interview was with Dr. Sethuraman in Dallas. Thank you. He actually had a really negative outlook on the medical field, specifically spine surgery. He told me that it was a dying field and definitely not worth going into, spending all the time and money to become a spine surgeon, but it not actually taking you anywhere in life. He told me the same thing he said he would tell his kids, saying not to become a doctor, and spine surgery is definitely not something you want to do. But I went through this interview, and with the help of Coach Goff, I took a positive outlook on this interview, saying, I want to prove people wrong, and I want to prove to people that spine surgery is something that will be needed, and spine surgery is something that, will benefit everyone in the future. My third interview was with Dr. Pelosa, who I originally wanted to be my mentor, but after the interview, it was almost impossible for me to get in contact with him. I called his office multiple times, and they never responded. Dr. Pelosa was a great doctor. He works at his own private clinic and he works at a hospital, so it would have exposed me to both fields. He works almost every day of the week except Sundays. He told me how spine surgeons operate, and it's every other day is a clinic day and every other day would be a surgery day. And he sees close to 15 to 20 patients a week for clinics, and he does close to 5 to 10 surgeries a week, for each surgery lasting from 1 hour to 12 hours. So his secretary and him actually offered me to go to a science convention that their office was holding on the next Friday, which happened to be Halloween. So I showed up at their office and everyone was dressed up, even the dogs were dressed up. I showed up there and there was a professor from the University of Connecticut coming down to talk about stem cells and stem cell research and how he's progressed in the field and how stem cells could progress in the spine field and how it would benefit people who have paralysis. My fourth interview was with Dr. Wan, and Dr. Wan actually lives really far from here, like in South Dallas, which made him less of a candidate to be a mentor, but the way he wanted to become a mentor or spine surgeon was the same way that I did, so he really appealed to me as a doctor. His dad had spinal problems when he was growing up and when he immigrated here, which I didn't immigrate here, I was born here, but growing up my dad had spine problems as well, which really got me interested in this field. Dr. Wan told me that it's a lot of schooling, and anything I need help with, he's always open. And even though I told him I couldn't accept a mentorship with him just because of the distance, he said, that's fine, but in the summers, if you want to come and volunteer, my office is always open. Which leads me to the last interview I had with Dr. Daniel Bradley, who just recently, last week, accepted to be my mentor. Dr. Bradley works at Forest Park, which is not too far from here. It's actually just down the road. And he works the same way as Dr. Pelosa, and he does clinic days every other day, and he does surgery days every other day. Dr. Bradley is actually a friend's dad here who goes to Frisco, and so I'm really comfortable with him being a mentor. I haven't actually had a meeting with Dr. Bradley yet, but I hope to be meeting with him soon for the pre-mentor visit and getting everything laid out. My research this year is my main focus will be willing to conduct research regarding ALS and paralysis, because recently there's been cases around the world of paralysis being able to be cured with stem cells. So with that in place, it's only very limited research, and the recovery is only very limited. Like, people who are paralyzed from the waist down are only able to take baby steps or are able to feel things in their feet now. So that's something I want to research definitely when I go into college, or hopefully this year if Dr. Bradley would help me with that. The paralysis that has been tested on has all originated in the spinal cord and can be cured with extensive treatment of stem cells and extensive working with doctors every day for a few hours. But alternatively, curing paralysis will result in loss of smell, because it takes from your olfactory bulbs, which are located in your nose, which are your sense of smell, and the stem cells in your olfactory bulb, because of you smelling so much, regenerate rapidly. So taking those and injecting those into your spine would, in theory, help fix paralysis, which has been tested. Regarding ALS, and specifically Stephen Hawking, who has ALS, ALS is fatal after 3 years, and Stephen Hawking has lived close to 50 years with ALS. Everyone knows pretty much ALS because of the ice bucket challenge, I guess, but what it is a degenerative disease in your spine, and over a period of time it slowly paralyzes your entire body, and it is fatal. It'll stop all your muscles. So I want to be able to help cure, or be part of the cure for ALS. For my original work, I've decided to make a website to inform people of the different spine surgeries that are there, the risks of the spine surgery, how the procedure is done, how the procedure can be better, the statistics of the post-op recovery, or after surgery, how well people recover and how well everything is done. Through this website, I plan to get maybe 25 to 50 of the top most common surgeries and show the symptoms of having this operation, or what you can do to avoid the operation, what the operation does, like the procedure, and how it can be bettered. My plans for the future is I'll be attending the University of Texas at Dallas, and I plan to major in biochemistry and minor in business and Spanish, because minoring in second language, especially Spanish, living here in Texas is really big in the medical field, because not a lot of people, if you go to South Texas, speak very well English. Minoring in business would help me on the management side of hospitals, because a lot of healthcare right now isn't really focused on the doctor, but more focused on the administration of the hospitals. So being able to be a surgeon and minoring in business, giving my input into a board of directors, would definitely be something I want to do to help the community of the patients and the surgeons and the doctors and the nurses better their experience in the medical field and better the patient's recovery and any process the patient would have with the hospital. I hope to attend UT Southwestern Medical School and graduate with an MD in orthopedics with a specialization in spine, which will sadly take me close to 14 years of schooling. Thank you for your time.